Hey y'all, welcome to Chill Chats, the Chill Counseling Team Podcast, your space for real conversations about all things wellness, from joy to pain to sunshine to rain. We're therapists, but this podcast isn't therapy, and it isn't a substitute for professional care. Even if you're a Chill Counseling client, what we share here is for conversation, not counseling. Take what resonates, leave what doesn't, and if you need support, reach out to a professional. Now, let's get into it. Today, I'm joined by Gabriela or Gabby Gutierrez, counselor intern who is currently completing her practicum hours under my supervision. She's the first Chill Counseling team member based in San Antonio, and she's bringing so much heart and thoughtfulness into the work already. In this episode, we explore trauma-assumed care, a compassionate and client-centered approach that assumes trauma may be present without needing to rush into it. We also talk about what it means to be a beginning therapist, why accessibility matters, and how tailoring care to each client's unique identity creates a more healing space for all. Now, let's dive in. Hey, Gabby.
Hey, Cori, how are you?
I'm doing pretty well today. How about you?
Good. I'm doing good. Yeah.
Okay. Well, welcome to the team. You're the first person that we've had in the San Antonio area.
Yeah, I'm excited. I'm excited to be on the team. I know we're all in Texas, but San Antonio is a bit more south, so it's different weather and Fiesta's right around the corner. So excited about that.
Okay. Yeah. What's Fiesta?
It is a week-long celebration here in San Antonio, just celebrating the Hispanic culture down here. Every day there's a theme, there's a party. It takes places in different, it takes place in different areas of the city. So, yeah, it's very fun.
Oh, that sounds fun. I love that. And I love that we're getting to learn more about Texas, the more clinicians that we've got in different areas and then just like all the ways that you embrace the local area and culture. So, you haven't been to your first official team meeting just yet. But one of the things that we do is sunshine and rain. That's something that Shauna came up with maybe a couple years ago. And so we used to just call it high and low, but now it's sunshine and rain. So it's like bright point of your week and the low point of your week. What we've been doing recently with the podcast, at least, is your sunshine is letting us know your favorite thing about being a therapist. And then rain would be your least favorite thing or the biggest challenge being a therapist. And so I'm going to ask you those, and then I'll ask you the fun question that we always add on when we do sunshine and rain.
Okay. Well, I think my favorite thing about being a therapist is just creating a space where someone or, different people feel comfortable or safe to be vulnerable. I think it's something that not a lot of people have the privilege to have. So that's my favorite part. And then my least favorite part, or I guess not least favorite, but I guess most difficult would be accessibility. That is something that is definitely always a challenge for me, trying to be accessible to enough people, but obviously there's monetary things involved when it comes to services. So I think accessibility is definitely a challenge.
Yeah, for sure. Because everyone should be able to access mental health care, and there is a cost. So, yeah, absolutely. It's my least favorite thing, too. Anything dealing with the money side of therapy, for sure. Okay, so, fun question. Maybe, I don't know if it's fun, but what is something that I would be surprised to know about you?
I think, I don't know if it would be, well, I guess it could be surprising, but I'm in the process of learning ASL. So I, I, I know enough to like have a conversation slowly. So I'm still learning. There's a lot of nuances and, it's fun to learn. I'm picking it up much faster than I than I did Spanish. So
Okay. Wow. That's so amazing. And it aligns with what you just said about accessibility, because making sure that services are available in your language is a part of accessibility. So whether you are doing that generally, personally, there's also that professional benefit of just working towards being able to provide care to more people. I love that.
Mhm. Thank you.
And I
Yeah.
did not know that about you.
Yeah, it's something that's fun. Learning. I work on it with my fiance. He's hard of hearing, so that's where it all started.
Mm,
And so yeah, we just practice every day, and it's just something fun for us to learn, and then of course, like you said, use it in the future.
wow, amazing. Well, so tell me a little bit about how you decided to pursue therapy as a profession.
Yeah. So. Um, Psychology in general has always been interesting to me. My mom is actually a school counselor, so um, just always been uh, around psychology, even just in the way that, my mom would speak to us as children. But growing up, I was very good at math. And I actually was on the track to do engineering. And I was actually putting myself through my bachelor's program. And although I'm good at math, I did not enjoy. It's just not as interesting to me.
Hmm.
And because I was paying for it myself, I figured might as well do something that I'm interested in, that I want to learn about. Um, and I got my bachelor's in psychology, and then a whole world opened up. There's so many different ways you can take that. So I've always just been like passionate, and always just naturally I'm always wanting to make the person in my presence feel safe enough to say something. And so I thought might as well use my what I do naturally and learn more skills and get more education on how to tailor that to help more people.
Yeah, I love hearing that. So you are a counselor intern right now, meaning you are finishing your graduate program. You've completed most of the degree requirements, and this is the final stretch where you're getting experience, hands-on experience in the counseling room or virtual room. And so I think something that can happen is people see the word intern, if they realize you're a student, and they could be hesitant. So, can you speak to what you bring to the therapy space to best support clients, even as a beginning therapist?
Yeah, so although it's my beginning journey of being a or providing services in a counseling space, I do have experience providing services in a ABA space, an applied behavior analysis space, which is under the umbrella of CBT, for children on the autism spectrum. So it's very ingrained in me to be a regulated person for someone who might feel dysregulated. I feel like that is something so important that I find myself in situations in work, not at work, where that is what someone needs in a moment of chaos or uncertainty. It's just someone who's not quick to answer, someone who's not quick to judge, to try and find the answer, or, just someone to sit there and listen and remain calm. And I think I have so much experience doing that, working with children. So I think that's something I am definitely bringing into the therapy space as well.
Right. So, you've had experience helping others and practicing some of those basic skills that are so important to therapeutic relationship and creating that supportive space.
Yes, exactly.
Yeah. Okay. Well, tell me a little bit about what some of your areas of focus will be as you continue your journey with us.
Yeah, so I'm definitely passionate about helping neurodivergent individuals, families, people of color, LGBTQ plus communities, uh, really just marginalized communities is where I find myself wanting to help the most. Like I said earlier, I think not a lot of people have the privilege of having a space where they feel safe, where they can be vulnerable. And I think that is something that I want so much to provide, even if it's just in this small space in San Antonio, compared to the global population. But yeah.
Right. Okay. Well, no, today we are talking about a topic related to your work and to what you'll be doing in internship, and that's trauma assumed care. So, trauma assumed care, that was a new term for me. So I imagine it will be a new term for many people, even those of us that are always in the trauma space. So, can you talk a little bit about what trauma assumed care is?
Yeah. So I learned this term from Dr. Greg Hanley. He is um, a behavior analyst who has published hundreds of studies and documents, and he works in the ABA space with people on the autism spectrum. One of the things that he talks about is, you know, for a child specifically who is in a neurotypical world, they display a lot of behaviors that aren't socially acceptable, like screaming. For example, when you're working with a 3-year-old child, sometimes screaming is age appropriate.
Mm,
Sometimes they don't know how to express the emotion that they're feeling. And sometimes it's a trauma response. And so, for us as clinicians in the ABA space, as clinicians, it's not the time to try and figure out which one it is. It's just, it could be a trauma response, and therefore we should handle it as such. So, again, just trying to help them become regulated and not trying to fix the screaming, because again, we don't know why they're screaming or where that came from, and if it is a trauma response, that's how they're responding to that trauma. So just helping them in that moment in time is really important. And I think that that's something that bringing into the counseling space is also really important as well.
yeah, and I want to talk more about that. Before we continue, because you are talking about ABA, there are quite a few valid criticisms around ABA or about ABA. And so, wondering if you can speak to those criticisms. 'Cause from what you're sharing, it sounds like there's been some shifting from ABA in its original form.
Yeah, for sure. I think ABA, it is empirically, it's heavy, it's heavily researched, and it does work. But I think the where it started, it was really just trying to get children or whoever's receiving the services to live in a neurotypical world, and kind of trying to change them to fit into the world in that way instead of, the world just accepting who they are, how they are. And now, especially with Dr. Hanley, he is at the forefront at a lot of these ideas and approaches, is that, getting a child happy, relaxed, and engaged and regulated before making them do something they might not want to do, or exposing them to something that they might not want to be exposed at. It's a better learning experience for them when they are happy, relaxed, and engaged. And it's a much more humanistic approach. It is a way that ABA is actually starting to shift towards. I have experience working at a center where it's child led and it's naturalistic teaching. So we were at the we're at the will of this child who, if they want to do something outside, we can practice their skill outside. If they want to do it while they're jumping, we can practice it while they're jumping. A lot of the times, if we are preparing that child to enter school, then that's when we'll practice the things where we're sitting them down for a certain amount of time. And like I said, just making sure that they're ready to practice those things before just forcing them. I think that's it's a much better approach, and it's much more effective, and it's a better experience for the child overall.
Yeah, I know one of the criticisms has been like the harm that some people that have experienced ABA have experienced. And so what you're saying is there's an approach now, or at least in some places, maybe, at the center that you're speaking to, where because it is so focused and led by the individual, there's a lot less risk of harm. And the way that you talked about that sounds so much like a psychotherapy clinical approach. And so I'm wondering if you can talk a little bit about, because obviously we're not doing ABA at Chill, but I'm wondering if you can talk about like how you pull things like trauma assumed care and some of the other things that you mentioned into your approach.
Yeah, so I think when working with marginalized populations, going in with that trauma assumed lens kind of, I mean, it helps build that trust. It helps create this space that's safe, that maybe, once entering the room, you don't have to directly talk about the trauma. We can sit in a space where you're in a marginalized population. We can assume that you experienced some adversity, and, easing into the trauma, even just behavior, emotions, things that, it's very easy for someone to be judgmental or quick to try and fix something about a person, could be a trauma response. And so, without exploring that, just entering the room and applying that trauma assumed care, I think kind of gives the individual a sense of not having to be so hasty in the therapeutic process.
Yeah, it sounds like if you are approaching with this trauma assumed lens, there is an opportunity for compassion where you would seek understanding of those behaviors, whether those are things that only you as the clinician are observing, or they are things that the client's already identified as problematic, things that they want to change, but not judging it, maybe even not diagnosing it. It really just trying to understand, okay, where did this come from? Knowing the adversity we can maybe assume, generally just trusting that there's probably a story, there's probably context for it, and if we explore that more, we don't have to focus in on the problem so much as the human.
Yes, exactly. And I think especially when it's an emotion or an outburst related to anger,
Mm,
some people are so quick to feel shameful that they had that outburst or that they did something in anger. And, in a therapeutic space, there is no judgment. And like I said, if it is a trauma response, or maybe it was very loud, you were overwhelmed, there's a lot of things going on, it could be a factor of things, and not being quick to judge or having to fix that behavior or having to quickly fix that problem. I think it's it feels like a bit more relaxed in something that might get, the client fired up or might have intense emotions. I think just having that space where we don't have to blatantly say out, where it's coming from. We can just sit with that um, and work through that, together.
wow. Yeah, it creates an opportunity for exploration if that's desired, but just really just being and understanding. And yeah, we don't have to fix it, we don't have to judge it, we can learn from it.
Hmm. Yes.
Okay, yeah. So are there any other things that you would add in terms of it, what it would look like for a clinician to apply trauma assumed care.
Yeah, so I think it's really just about tailoring the treatment to the unique individual and their unique story. The program that I'm in for my master's, it concentrates very heavily on multiculturalism, intersectionality, and all of those things affect the adverse experiences that a lot of people go through. And when you're approaching a session with trauma assumed care, you know, you are letting the client narrate it from their point of view, whether they're mentioning trauma or not. You can sit there and leave that space where this person more than likely experienced an adverse experience. So I think it's just a way to approach a session, or even just the therapeutic space in general. I think it it's a very gentle lens, but also an understanding in a way where someone doesn't have to blatantly say what the trauma is, but they can approach that trauma, if there is a trauma, or or their behavior, or their emotions, or their feelings, without having to do it too quickly, if that makes sense.
Right. And I see how this fits in with trauma informed care, because it sounds like this is really maybe the stage one of, there's a triphasic model of trauma, or trauma therapy, where, meaning there are three phases of the treatment, right? And in the first one, you're really just focused on stabilizing. So that's when you're, just grounding, and you're not even tapping into like trying to process. And I could really see how a clinician going in, before you even know if there's a phase two, just assuming that there is. And phase one is like, how do we get you relaxed in your body and just being. So yeah, I mean, I really like this, and I hope that we hear more about this term in more psychotherapy spaces. So thank you so much for bringing that to us.
Yeah, it's definitely something that is in the ABA realm, or starting to be, which is very exciting. But even working with neurodivergent families, or like I said, just any really marginalized populations, I think it's definitely something that helps tailor the treatment plan to the unique individual and all of the intersectionalities that they identify with.
Okay, so I love what you're saying about that, because I see how it works for a lot of different populations, and you think about the background and identity of the client, but also this was started in a space that is where primarily the clients are children. But the way that you've described it, I can see how you'll use this whether you're working with, a really young human, or, an elderly one. Elderly human sounds crazy to say, but, I mean, but I guess what I'm saying is, I really see how you are able to look at these different components of the approach within one setting, and then pull from it and apply it here. And that's what we're all about. Like, we will bring in anything. We do our evidence-based approaches, but we're going to grab from art and music. We'll, if the client has an interest, we'll bring that in. And so, like, pulling from philosophy or math, but just really using different strategies so that it is tailored to the client. And so you being able to see that to bring into this space, I think that is like, you've already obviously got a really solid foundation. I'm just excited to see how you continue to grow as you support so many clients.
Yeah, and I'm excited to do that. I think working with children in general, and then of course working with children who are nonverbal and have different communication styles, it's definitely something that is a foundation, like you said, that will help me with every aspect of my life. I think that helping someone identify an emotion and express that emotion. That's something we do in ABA, but that is something that is still very relevant as an adult.
Absolutely. And we were all children. So a lot of times the things that we're processing now came from there. So, tools that we can use with kids often are really powerful in adulthood because we get to speak to that part of us.
Mm-hmm.
Yeah. Thank you so much for sharing this. So, obviously, you know what you're doing, you're learning, but you have a good idea of what you're doing. So if someone wants to work with you or they think that someone would be a great fit for you, how can they get in touch with you?
Yeah, so of course on the website, chillcounseling.com/Gabriela, you'll see my page. You can schedule a 15-minute consultation just for us to speak one-on-one. And if you like how that went, then of course we can schedule a session.
That's awesome. All right, thank you. I can't wait to have you back to talk more about, supporting the families of individuals with neurodiversity and yeah, and just see you continue to flourish. So thank you so much.
Thanks, Cori, for having me.